Hello everyone. Today I am going to tell you how to assess the airway and breathing in children. So this will cover the competency 27.15 in which how to assess the airway breathing, what are the various signs of severe respiratory distress. A student should be able to recognize this, how to check for the cyanosis, how to assess for the chest in drawing is present or not and categorize into mild, moderate and severe, and then various adventitious sound, example grunting. So this is the competency which I am going to teach you today. First step in airway and breathing assessment is see the child is breathing or not. So by look, listen and feel you can label child is breathing or not. So look at the child. If child is active, talking to you or crying if infant, that means child is obviously breathing. Then you have to assess the signs of respiratory distress. If child is not active, not talking to you, not crying, then see the chest movement. If chest is not moving, that means child is having respiratory failure or child is in apnea. So in such case, you have to maintain the airway, then intubate the child and start the resuscitation. If child is breathing, then listen for the breath sound. Auscultate both the lung fields and see breath sounds are audible or not. Then feel the breaths at the nose and mouth of the child. So if the child is breathing, then you will have the feeling of air movements at the nose and mouth. When the child is breathing, then see the signs of respiratory distress are present or not. So in this we have to calculate the respiratory rate, and according to the respiratory rate we have to label either child is having normal respiration or having tachypnea or bradypnea. So in video I will show you how to calculate the respiratory rate, how to label the tachypnea or bradypnea or apnea.
So respiratory rate, we have to calculate the respiratory rate for full 1 minute. We have to remove the cloth from the chest, and for full 1 minute chest rise should be calculated, and this is the respiratory rate. Now we label the normal respiratory rate in newborn between 40 to 60, in infant 30 to 40, in 1 to 5 year age group 20 to 30, and more than 5 years age group 15 to 20 breaths per minute. We label the tachypnea when respiratory rate in less than 2 months age group more than 60, 2 months to 1 year more than 50, 1 to 5 years more than 40, and more than 5 years age group more than 30 breaths per minute will be tachypnea. We label the bradypnea when the respiratory rate is lower than the expected, example in newborn less than 30 is the bradypnea. We label the apnea when cessation of the breath for at least 20 seconds, or if the cessation of the breath for less than 20 seconds with bradycardia and cyanosis, we label the apnea.
Other signs of severe respiratory distress other than tachypnea or bradypnea or apnea, see the chest in drawing. So if the child is having severe respiratory distress, then chest in drawing will be present. So right from the alar nasal flaring, supraesternal retraction, intercostal retraction, subcostal retraction, you have to check. And in severe lower chest in drawing, there will be inward movement of the bony structure of the chest wall during the inspiration occur. So this is characteristically labeled as a paradoxical respiration. I will show you in next video. Head nodding is also the sign of severe respiratory distress. In severe category, apneic spell may be present and child will not accept the feed with the severe distress. So here in this video you can see child is having the paradoxical breathing. Inward movement of the chest occur during the inspiration. We label as a paradoxical breathing. It is the sign of severe respiratory distress. So for other signs of severe respiratory distress, we have to see the alar nasal flaring is there or not, head bobbing, supraesternal retraction, tracheal tug, sternal retraction, intercostal and subcostal retraction should be checked. So here you can see child is having head bobbing or head nodding with each and every respiration. with the alar nasal flaring and subcostal retraction. Here also characteristically supraesternal retraction of tracheal tug is present with each inspiration. Here also child is having the supraesternal retraction prominently labeled as a tracheal tug. Here you can see alar nasal flaring, external retraction and also the subcostal retraction and paradoxical breathing. Here also prominent subcostal retraction. Here also child is having supraesternal, intercostal and subcostal retractions. So all these are the signs of severe respiratory distress. We should check. Here in this video also you can see child is having tachypnea and severe signs of respiratory distress, subcostal retraction, intercostal retraction, alar nasal flaring all are present. In signs of severe respiratory distress, then see the any audible sound is there or not. Example, stridor, grunting or gasping movements can be there. So stridor suggests that child is suffering from laryngotracheal bronchitis or epiglottis inflammation. It is a harsh noise audible during the inspiration when child breathing in. Remember, when child breathing during inspiration, audible sound is there with the supraesternal retraction. That means it is stridor. It suggests child is having either involvement of larynx, trachea or epiglottis, either inflammation or congenital malformation. Grunting sound is the expiratory sound when infant exhale against the partially closed glottis. It is seen in the preterm newborn with the respiratory distress syndrome. I will show you the video of stridor and grunting. Gasping is the spasmodic open mouth breathing associated with the sudden contraction of diaphragm and retraction of hyoid apparatus. It is the manifestation of brain hypoxia. It is seen in very late stage when patient is having the respiratory failure due to the any problem, and patient will expire if not treated timely. It is a grievous sign. Now in this video you can see child is having severe respiratory distress with the supraesternal retraction and stridor sound. This is the stridor sound. During inspiration, child is having audible stridor. Here also, child is having supraesternal retraction with stridor. This is stridor sound. So it is clearly audible in both the videos.
See, the child is having the severe grunting sound because of the
Respiratory distress syndrome, this preterm newborn is having the audible grunting sound. Then see the central cyanosis is present or not. So for this, look at the mouth and tongue. If there is a bluish or purple discoloration of the tongue, lips or inside of the mouth, it indicates child is having central cyanosis. So by this way, we have to assess the airway and breathing of the child. Thank you so much.